Welcome to Lesson 3. In this lesson, we'll learn the data element of medical decision-making. We'll understand the amount and complexity of data reviewed, including medical records, diagnostic tests, external records, independent interpretation, and discussions that help determine the correct E/M coding level. Before we begin, this training is for educational purposes only. Always refer to the latest CPT, ICD-10CM, HCPCS Level 2 manuals, payer policies, and official coding guidelines when assigning medical codes. In this lesson, we'll review the E/M guidelines and understand the basics of medical decision-making. We'll focus on the data element, one of the 3 MDM components. You'll also learn the 5 data levels: none, minimal, limited, moderate, and extensive, and how they help determine the correct E/M code. Medical decision-making, or MDM, is the process physicians use to diagnose a patient, assess their condition, and choose the best treatment plan. MDM is based on 3 key elements: the number and complexity of problems, the amount and complexity of data reviewed, and the risk of patient management. In this lesson, we'll focus on the data element. Data refers to all the medical information a provider uses during an encounter. This includes medical records, diagnostic tests, and other clinical information that is obtained, ordered, reviewed, or analyzed to support patient care. Data can also come from multiple healthcare sources. Discussions with other healthcare professionals and test interpretations that are not separately reported may also count toward the data element in medical decision-making. The data element is divided into 3 categories. Category 1 includes tests, documents, orders, and independent historians. Category 2 covers independent interpretation of tests. Category 3 involves discussions with external physicians or other qualified healthcare professionals. We'll explore each category in the following slides. This diagram summarizes the different types of data used in medical decision-making. Data includes tests, documents, independent historians, independent interpretation of tests, and discussions with external physicians. We'll review each component individually. Tests are one of the most common data components. A physician may order a diagnostic test or review the results. Each unique test contributes toward the data element. Reviewing previous medical records, referral notes, or external physician documentation also contributes to the data element. Each unique document is counted separately. When a patient cannot provide reliable information, the provider may obtain history from an independent historian, such as a parent, caregiver, or spouse. This contributes to Category 1 data. Independent interpretation occurs when the physician personally reviews and interprets a diagnostic test without billing separately for that interpretation. This belongs to Category 2 of the data element. The final data component involves discussing patient management or test interpretation with an external physician, another qualified healthcare professional, or an appropriate source. This is Category 3 of the data element. CPC tip. Remember the flow. Tests right pointing arrow, documents right pointing arrow, independent historian right pointing arrow, independent interpretation right pointing arrow, external physician discussion. Tests are an important part of the data element in medical decision-making. They include imaging studies, laboratory tests, psychometric tests, and physiologic tests. Each unique test is identified by its captain code. Ordering a diagnostic test means the physician requests the test to be performed. Reviewing a diagnostic test means the physician evaluates the completed test results as part of patient care. When the physician both orders and reviews the diagnostic test during the same patient encounter, it is counted as part of the data element in medical decision-making. This helps determine the overall MDM level. Shared decision-making means the physician and patient work together to choose the best management plan. The discussion includes benefits, risks, and the patient's preferences. A patient may request a diagnostic test that is not medically necessary. The physician explains the risks and lack of benefit before deciding whether to order the test. Sometimes a diagnostic test is not ordered because the risks outweigh the benefits for that patient. The physician should clearly document the reason for not ordering the test. Data analyzed means the physician reviews available clinical information to support diagnosis, evaluation, and treatment decisions as part of medical decision-making. Not every piece of data requires a detailed interpretation. However, important clinical data, such as a glucose value, is still considered during the physician's decision-making process. Certain diagnostic tests have their own captain codes. These services may be reported separately while the EM service is coded independently. If the physician recommends a test or treatment and the patient declines, or if the physician decides not to perform it after evaluating the risks and benefits, the decision is still counted in medical decision-making when properly documented. Results-only tests are non-imaging tests that do not require a separate physician interpretation. Common examples include COVID-19 tests, pregnancy tests, and influenza tests. Although results-only tests do not qualify as independent interpretations, they are still included in medical decision-making. When these tests are ordered or reviewed during the encounter, they contribute to selecting the appropriate MDM level. Independent interpretation means the physician personally interprets a diagnostic test that has a captain code. This interpretation is counted only when it is not reported separately. A common example is an EKG interpreted by the emergency physician. When the interpretation is documented and not billed separately, it contributes to the data element in MDM. If the interpretation is billed separately by the same provider or another provider in the same specialty, it does not count toward data points in medical decision-making. A test counts toward the data element when it is not separately billed by the same specialty, or when the interpretation is performed and billed by a different specialty. For example, an emergency physician orders a chest X-ray, and a radiologist performs the interpretation. External records are medical records, test results, or communications received from providers or healthcare facilities outside your practice. These records help support medical decision-making. An external physician or qualified healthcare professional is someone outside the same group practice or from a different specialty. Information from these providers can contribute to the data element. An appropriate source is someone involved in the patient's care but not necessarily a healthcare professional. Examples include a case manager, teacher, lawyer, or parole officer. Routine conversations with family members or caregivers are not counted toward the data element. They are counted only when needed for patient management or to obtain important secondary history. The data element in medical decision-making has 5 levels: none, minimal, limited, moderate, and extensive. The level depends on the amount and complexity of data reviewed. Minimal data requires very little information. Limited data includes reviewing tests, external records, or obtaining information from an independent historian. Moderate data is achieved when the physician meets any one of the 3 data categories defined in the MDM guidelines. Extensive data requires meeting any 2 of the 3 data categories. This represents the highest level of data complexity. For the CPC exam, remember the 3 data categories. Category 1 includes tests and documents, Category 2 is independent interpretation, and Category 3 is discussion with an external physician or qualified healthcare professional. Let's quickly review today's lesson. We learned how the data element is used in medical decision-making, including reviewing tests and records, independent interpretation, and discussions with external providers. Understanding these concepts will help you accurately determine the appropriate EM coding level. Thank you for watching. If you found this lesson helpful, please like, share, and subscribe to KS Medical Coding Academy. I'll see you in Lesson 4, where we'll discuss the risk element of medical decision-making.